when you have a guy that comes in that's losing hair, they're willing to throw the kitchen sink at the hair. It's like the female patient for their face, the guys for their hair. They're like, bring it at, give it to me. I'll take anything. And so it's just such a different mindset, of what guys are really focused on versus what women are focused on. Not to say women aren't focused on hair loss. Of course, that's a huge deal, but we get guys coming in earlier and earlier now, don't we? Talking about hair loss. I feel like the new paradigm and expectation is that men are not supposed to lose hair anymore. I don't know if you guys agree.
Yeah, I think that it's changing for sure. And a lot of it is the rise of social media and just the societal acceptance of men being allowed to even care about some of these things and some of these topics that they're more comfortable bringing into our office. Hair loss for sure, but I think it's also because now we have some effective treatments.
Yeah.
Yeah.
And also,
Terrence, you
yeah,
agree?
yeah, hair loss. I mean, so with women, the first signs of wrinkles or signs of photo aging is the first giveaway for aging. With men, the number one age accelerator. So there's done studies looking at guys with a ton of wrinkles and brown spots with a good head of hair, and a guy with no wrinkles, no brown spots, and balding. The balding guy looks older. So, for men in particular, a receding hairline is the number one age accelerator to other age older age appearance to others. So that really gets their attention at a young age. And if it happens at a young age or any age, especially if they start looking different than their contemporaries, so they're losing hair compared to their peers, that makes them look older and feel older. So they're going to be very proactive. Whereas a wrinkle here and there, is not the end of the world for a guy. You can see some of these recent male celebrities have been critiqued getting facelifts and getting rid of all their signs of periocular aging, and people are criticizing them because they almost look weird because there's no any evidence of aging. Whereas, a female celebrity in the 60s gets a great facelift and everyone's celebrating and trying to find out a plastic surgeon. So, there is this, a little signs of aging in the male face is not necessarily the end of the world.
It's actually considered
Yeah,
attractive.
but a nice head of hair is considered very attractive. So you can see why
Right.
there's sometimes a overemphasis on hair versus skin in a lot of our male patients.
It made me realize as you gentlemen were talking about this, that guys can't, early on in life, they don't want to lose any hair because that's a sign of aging. And later on in life, they don't want to lose their virility and their exercise tolerance and their energy because that's a sign to themselves that they're aging. And so they get on testosterone, for example. Well, we know what testosterone can do to the skin, and that kind of changes our paradigm of skincare. As the older men in particular get on testosterone, things totally change, Corey, right?
Oh, 100%. Yeah. I mean, testosterone, I've seen it wreak havoc on acne. I've seen it cause, additional hair growth in places that they don't necessarily want it. So there's a push and a pull with everything. And testosterone is included in that number.
Yeah.
Yeah.
And the dose matters. I mean, I think testosterone could be just like anything, could be managed appropriately, but I think a lot of, testosterone is one of those weird things where people go online and get mega doses, and that's where you see the problem. And guys, you know, being muscular is kind of addictive, and all of a sudden they're in their 40s and 50s and they want more muscle and they keep up in the dose, and that's where you run the problem. So it's kind of super therapeutic, super kind of physiologic doses of testosterone.
Yeah, I mean, we start getting some major issues with cystic acne. We start getting issues with sebum production, and that causing closed comedones on the face or blackheads on the face, and then we start to really have to up our retinol game to kind of keep up with all these different changes that are happening. In addition to that, we have seasonal changes that we expect throughout the year, where summer is a little bit more oily and easier to hydrate versus winter, where everything gets drier and you have to maybe change your retinol routine and your moisturizer routine as well. So there's a lot to deal with guys, just like with women. As they get near and enter menopause, skin changes dramatically. Men tend to do that just exogenously with testosterone, and we have to deal with that. So don't think that you can see your male patient one time, recommend a great foundational skincare regimen, and that's it. You'll need to see them back to tweak it, because their life is going to change, and you never know what supplements and medications they're on that can change their hormones.